A lot of our work that we do here is in collaboration with the school. We are here on the invite of the school, so we need to tailor what we do to what their needs are. We've got two streams of information that we get and two streams of needs that we address. So, firstly, it's the individual clients and individual referrals. So that goes through a specific process within the school to get a referral to the clinic, and then we have our own processes to get them allocated to the students. The individual clients we will discuss with the clinical supervisors or clinical educators to work out if it's possible to do IPP sessions with those students. Some of them it's not available, some of them it is, but we try as much as possible to have 50% IPE sessions, 50% individual sessions per client. The other side of what we do here are group therapy or class therapy. Any group activities that we do with the school have a therapeutic basis. So at the start of each year in particular, we sit down with the school and ask them what they need, what they'd like. We do have some established programs here. For example, one of them we call Grasshoppers. It's a circuit activity that the physio students run with the other students helping out. So the children all jump through hoops and crawl through tunnels and these sorts of things. There's also an established classroom therapy for one of the classes that are at least 3 years behind in their numeracy and literacy. And the occupational therapy and speech students do rotations of class-based therapy for all of the students within that classroom. So they're just some of the established programs, but we do change other things every year. Communication is probably the most important thing we have here. So communication with the school, particularly the individual classroom teachers, but also the clinical supervisors and clinical educators. If the clinical supervisors and clinical educators don't feel that the activity is within the scope of the students, there's not much point at going ahead, because there's a lot of activities that they can do here and we want them to get the most out of the practice. So we do have regular meetings, even if they're informal hallway ones, to work out what is going on. But we also get a lot of feedback from the students and the school. So as activities are going, as sessions are going on, we can adapt them to meet the needs of both the students and the school. So one of the simplest programs we use or activities we do is professional development. So we call it toolkit time. It's a very short presentation. Usually they do a 15-minute PowerPoint plus a flyer for the other students in different disciplines about something that might be core to their discipline that other people might not understand. So, for example, emotional regulation is a huge thing here. It's very simple for occupational therapists because it's something they do all the time, but no one else understands it, no one else sees it on a day-to-day basis. So they'll give a quick presentation about that, educate them. The students can ask questions, and then it's also useful for those other disciplines to apply in their practice. Or if they notice a child has one of those issues, they know, okay, I need to refer them to occupational therapy. The other thing that we do as part of this area is our toddler clinic. So doing early screening. So the occupational therapists and the speech pathologists, they will meet with a parent and the child and do an assessment on the child, a screening assessment to identify if they might require referral to child development services, or if there might be a larger developmental delay that might need assessment for NDIS, or if there are some tips and tricks for the parents to do at home to make sure that they do catch up by the time that they get to school. So it might not be severe enough to require therapy at that point, but if they don't start acting on it, it could develop into a problem. On site, we have dietetic students and medicine students. Um, these two don't have a caseload. The idea of their placement is to get exposure to the different developmental ages, learning how to interact with them, seeing children and families in a community setting, seeing what is normal, what might be a problem. So we try to tee them up with the client, with the professions that have a caseload, so they can see what those disciplines do. So, for example, when the medical students become doctors, they'll know if they see a child with these issues, they refer them to this discipline. I think the easiest activity that can possibly be done is the interprofessional education. So, having one discipline educate another discipline. The next step up from that would be the disciplines shadowing each other and reflecting on the practice, and then potentially doing combined sessions. So, identifying needs from both disciplines and then designing activities that would address both needs. There are a few big bonuses for this type of service. The school gets a lot of different disciplines for free without having to go anywhere. So they get a lot of services. The students who normally wouldn't be teamed up together in other clinical environments get to work together. So they get to see what other disciplines do. It's very rare that you would see a physio working with a speech pathologist. You're not going to see that. The only time they might be in a team meeting would be in a hospital where you've got a large case conference happening. I'm a nurse by background. I didn't know half of the things that the occupational therapist did until I came to work here. So I've been doing the job for 20 odd years. So for me to learn new stuff at this later stage in my career is very valuable. But if I had that knowledge right at the start, I think it could have opened up a lot of opportunities. So trying to give them this opportunity very early on, it gives them a better understanding of how the health system works and how they can give holistic care to their clients.